A COVID vaccine update, read to you by Carol Brigham. COVID-19 progress? In early summer 2021, the number of COVID-19 cases in the United States was decreasing. Hospitals had fewer COVID patients. Businesses were reopening. People were traveling again. President Biden gave a speech on July 4th, Independence Day, saying Americans were closer than ever to ending the pandemic. By the end of July, things looked very different. The COVID-19 virus had mutated. The new strain of the virus was called the Delta variant. It was more dangerous. It spread more quickly and made people sicker. The number of COVID-19 cases in the United States began to increase again. On July 27, the Centers for Disease Control and Prevention, CDC, said more Americans needed to get vaccinated. The CDC also said that people should start wearing masks again to slow the spread of the Delta variant. The vaccines. In December 2020, the Food and Drug Administration, FDA, gave emergency use approval to the Pfizer and Moderna COVID vaccines. Both these vaccines needed 2 doses. In February 2021, the FDA gave emergency use approval to the Johnson & Johnson vaccine. It was only 1 dose. Emergency use approval for vaccines and medications is used during national health emergencies. This allows companies to make and distribute vaccines and medicine before they have formal approval. The companies must show that their product works and is safe. The companies must apply for formal approval, or they can no longer make and sell their vaccine or medicine. Who got the vaccines? Healthcare workers, people in nursing homes, and people with health problems got the vaccines first. It was hard to find vaccines. People had to make appointments online or stand in long lines. Each state made its own vaccination plans. Some states' plans worked better than other states' plans. Some people traveled to other states to get vaccines when they could not find them close to their homes. When more vaccines were available, the U.S. government partnered with pharmacies across the country to give vaccines. Neighborhood groups and businesses had vaccination clinics. They wanted to make it easier for everyone to get the vaccine. Still problems. Now, there are enough vaccines in the U.S. for everyone who wants them, but there are still problems. Some people do not want the vaccine. Some people are worried about side effects. Some people want to wait for full FDA approval. Children under 12 years old and people with allergies to the COVID vaccine cannot get it. The CDC says the Delta variant is most dangerous for people who are not vaccinated. Unvaccinated people are more likely to have a severe case of COVID and need the hospital. Most people who are dying from COVID now are unvaccinated. The CDC warns that if more people do not get vaccinated, COVID may mutate again. They say a new variant may be stronger and more dangerous. They say the current vaccines may not work on a new variant. On August 23, the FDA gave the Pfizer vaccine full approval for anyone 16 years and older. The vaccine's new name is Comirnaty. The FDA and the CDC say this vaccine is safe. They hope that more people will get this vaccination now. Back to school. As schools reopened this fall, the number of children getting COVID-19 was increasing. Some parents were afraid of their children getting sick. Some parents worried that schools would have to close again. Some parents wanted schools to make students wear masks and get vaccinations. Some parents did not want mask or vaccine mandates. School boards and district leaders made plans, but these plans may change as the school year goes on. Parents, teachers, and school officials will need to work together to keep students safe. A new plan. On September 9, President Biden announced new federal rules to help stop COVID. He said all federal employees and contractors are required to get vaccinated. Companies with over 100 employees have to make their employees get vaccines or have a COVID test every week. These companies also have to give employees paid time off to get vaccines. Employees at healthcare centers that get Medicaid and Medicare funds must get vaccinated. Some governors and companies may try to fight these new rules. For more information about Easy English News, or to subscribe to our digital or paper edition, visit our website, easyenglishnews.com.